Hello everyone, I am Dr. Ramachandran, practicing as a consultant spine and deformity surgeon in SpineDRX Center in Bangalore, and I give my inpatient services in Aster Whitefield Hospital, Bangalore. So when we hear about spinal tumor, everybody will have the fear that whether I will be able to walk the next day. So this fear I will demystify and I will help you to understand what is it, from where does it come, and how to come out of this problem. Spinal tumor, when it happens next to the spine, which is usually made out of a bone, disc, and nerve structures. So a tumor can come not just from the bone, but also from the spinal cord. So we classify them as two varieties. One is a spinal tumor, another is a spinal cord tumor or a nerve sheath tumors. As such, the commonest problem with which the spinal tumor presents is usually related to metastasis. What is this condition? So we classify the spinal tumors into two varieties. One is a primary tumor, another is a secondary tumor, also called as metastatic tumors. Here, the most important difference which happens here is a primary tumor is one where the abnormal growth of the cells happens from the spine itself, which is called as primary. And in case of secondary, other parts of the body, say it could be lung, it could be breast, it could be thyroid, from where the primary malignancy started spreading across the body and reaches the spine, which we call it as a metastatic tumor. Why this is important is completely the difference of treatment, everything starts based on the pathology from where it comes into. So the primary spinal tumors, which arises from bone or from the nerves, could be of two types. Either it could be a benign tumor or it could be a malignant tumor. So how does it make differences? Benign tumors are usually, when we say benign tumors, it's when compared to malignancy, it's more of safe because it's going to grow very slowly. While the malignancy condition is going to be growing very fast and it can end up in very drastic problems even before the patient comes to know about the problem he has. So now we understood that these spinal tumors are coming from different places or it could come from the same site. They present with almost like a common symptoms only. The commonest symptom with which the people present to us is back pain. So when it comes to back pain, primary spinal tumor or the malignant which comes as a back pain cannot be differentiated from the other varieties. Say even a person who is sitting from long time in the office working in front of system also develops a back pain. But how to differentiate that? To differentiate the two varieties is the commonest back pain is a mechanical back pain, which is something like when we sit, stand, walk, and run, that is where the people develop pain. But in the conditions of spinal tumors, this is a non-mechanical variety, which means even at rest, they will develop pain. Especially the early morning pain. The pain is not allowing them to sleep, is the most common type with which the people present. So this is the most important understanding. So if any of us have a back pain which is present even at rest, we have to be very much alarming and we have to be very much alert. In addition to back pain, when this tumor starts growing, it starts encroaching into the condition of the spinal cord and as well as nerves. When the spinal cord and nerve is being touched, we develop conditions like numbness, tingling, and as well as sciatica type of symptoms. So these are the two symptoms with which the patient presents with a non-mechanical back pain and some amount of neurological problems like pain, sciatica, numbness, tingling. And if the worsening has happened to a significant extent, people might even end up in having numbness or even paralysis of the legs. And sometimes the worst scenario is losing the control over the bowel and bladder as well. So early diagnosis is the key. Early symptom is to be understood by the patient and he have to meet the doctor at a right point of time. The goals of treatment in spinal tumor is usually two. One, to preserve the function of the nerves and the spinal cord and to achieve a complete cure, which means complete removal of the tumor itself. This could be done by variety of modalities. One, the commonest modality which could be done is just observation. Not all spinal tumors needs treatment. For example, a spinal hemangioma, which is something like a mole in the skin, could be silently there within the spinal vertebra, which need not to be addressed. Other varieties of treatment looks like medical management, where we give drugs called as chemotherapy drugs, which are commonly used to reduce the size of the tumor to completely cure it. Example is being myeloma. Myeloma, which is a medical problem where we give drugs to control the tumor and we can achieve a complete cure with the medicines itself. There is another modality which we call it as the radiation therapy, where a focused specific amount of radiation doses are given to the spine to achieve a complete cure. Another, the most important, very important structure, which is the spine, which needs, and surgical treatment is also been available for spinal tumors, which I am specialized with it. We deal with these spinal tumors specifically by having a consultation with the medical tumor board, and certain conditions which needs neoadjuvant chemotherapy, where we give chemotherapy drugs to the tumor, reduce the size of the tumor, excise the tumor, and then further we do considerations with chemo also. Certain tumors needs palliative surgeries, palliative therapies, which is also I am well versed with, using the robotic technologies, using high precision navigation surgeries. We do for almost all spinal tumors to achieve a complete cure to the patient. The treatment should be tailored specific to the patient so as to make them not just increasing the quantity of life, but also to improve the quality of life and a pain-free life. Visit me if in case needed, specifically if you are or near ones, dear ones having these type of problems. I'm ready to help you. We have a group of multidisciplinary team doctors readily available in Aster Whitefield Hospital and SpineDRX Center to help all these type of patients. Thank you.